February 6th through the 10th is Austin Beauty Week, brought to you by the American Heart Association, and it's part of their Go Red for Women movement that we'll explain. Joining me now is Glenn Hushka from the American Heart Association and Dr. Alyssa Thompson of the Heart Hospital of Austin. And we always know pink is breast cancer awareness, red, heart disease awareness, which is the #1 killer in men, which most people may know. It's also #1 in women. Talk about that.
Since 1994, more women than men have died of heart disease every year. More women died last year of heart disease than women who died of any cancer combined. So it is absolutely a very serious public health threat. 1 in 3 women will die of heart disease. 1 in 31 will die of breast cancer. And most women think that breast cancer is certainly their biggest threat. So we're trying to get the word out about women's risk.
Sure. And Glenn, talk about the Go Red for Women campaign, why that is so important.
Well, it's important because not only are we trying to create awareness that heart disease is the top health threat to women, but also heart disease is 80% preventable. And so what the Go Red for Women movement tries to do is give women real-life, concrete solutions to ways that they can improve their heart health, in addition to raising awareness that it is the #1 threat.
Sure, and Doctor, talk about some of the risk factors that you alluded to, and what are some of the warning signs?
Sure. More than 90% of women in the United States, adult women, have more than one risk factor for heart disease. Hypertension, which is also known as high blood pressure, high cholesterol, diabetes, obesity or sedentary lifestyle, family history of heart attack or stroke, tobacco use. Those are the main risks that we look for women and men for heart disease or stroke.
What are the best ways to prevent or at least monitor the heart disease?
I always suggest that women find out what their actual blood pressure is if they're not used to going to the doctor. Just go to the grocery store, the pharmacy, you can check your blood pressure there. If it's more than 130/80, it's time to go see a doctor. You should also know what your cholesterol levels are. If you're a diabetic, you need to know what your hemoglobin A1C is. If it's less than 6.5, then you're safe. If not, you really need to be followed very closely by a doctor. Every woman should be out walking or doing some form of exercise for at least 30 minutes a day. So those are some risk factors and easy ways to know about them and improve them, but you should definitely be seeing a physician if you have any one of those risk factors.
And the Go Red campaign in the Austin Beauty Week actually has a kickoff event next Friday, right?
Next Friday, the February 3rd, is our National Wear Red Day. It's really the Super Bowl for the Go Red for Women campaign. We've got a lot of events going on in February. We're going to start with our celebration at Barton Creek Square, which will take place from 11 to 2 on Friday the 3rd. We're going to have red dresses, we're going to have free makeovers, free health screenings, all sorts of fun things going on that day. And the Red Dress Dash, which is kind of a silly relay race with a serious message. So that starts our day. Later that night, we'll have a kickoff party for the new Austin Beauty Week. And then the following week, as you mentioned, the 6th through the 10th, all sorts of beauty-based businesses throughout Central Texas will be having in-store specials and events with proceeds going to benefit the Go Red campaign. So it's a busy, busy time for us, but definitely a great time for us to raise awareness about the issue and have a little fun, too.
All right. Well, everyone start saving all of your red clothing now. Get them cleaned and ready to go for next week.
Thanks and we'll get you a dress pin to wear
all right,
on
there you
the
go.
air that day.
Thanks for joining us.